On to some other stories this evening, and medical records show that the rotational nurse who was at the center of the Ridge Hospital altercation did not suffer any fracture or dislocation and was treated with pain relief and offered psychological support. This was contained in the report of the 6-member committee tasked to look into the incident. George Queening reports.
The Ridge Hospital altercation happened on August 17. Almost 2 weeks into the incident, the committee tasked to look into the incident has presented its report to the Sector Minister, Kwabena Minta Akando. The 48-page report exposed the weak security at the emergency department at the time of the incident. There was no delay in attending to the patient with suspected head injury, which led to the agitation by Ralph Williams and the motorbike riders that the said patient had been abandoned. However, it was found out that all diagnostics imaging equipment, including X-ray, CT scan, MRI, were faulty and non-functional. The rotational nurse on duty did not suffer any fracture or dislocations and was treated with pain relief and offered psychological support, according to medical records.
Honorable Minister, the committee also found out that although there is video evidence of verbal or word altercation between one Mr. Ralph, his colleagues, and the staff members of the hospital, we are yet to receive any video evidence or a witness account of an alleged physical attack or altercation. There is, however, documentation in the Hospital Health Information Management System that the alleged victim, that's Ms. Rejoice Tutu Bote, who is a rotation nurse, reported her injury to the hospital the day after the incident, that's on the 18th, and was further treated. There was no evidence of fracture on her left wrist or dislocation of her right shoulder, joint as documented by the medical records. She was, however, had been treated at the time we visited. Had been given some pain relief, it has been recommended for a bed rest, and also has received psychological support care.
The committee recommends an improvement in security at the facility, recruitment of additional clinical staff, which is described as woefully inadequate at the time of the incident.
There must be improvement in security presence at the emergency, the ambulance triage area, by adding at least one personnel more at the gate and ensuring that the gates at the ED are always manned by security personnel. Additionally, we also propose that the CCTV cameras around is very limited to some of the care areas. And so we propose that if it is not for any privacy, they should add on some more CCTV to give evidence and also ensure that the staff will know that somebody is monitoring them in their work.
Minister of Health Kwabena Minta Akando said among the recommendations, of which some are in progress, beefing security at the hospital will be implemented before Monday, September 1.
As for time frame of starting work on it, I can give you, but as to the completion of when that will be finally completed, that will be another thing. As for especially the emergency issue about security, I can assure you by Monday, from here, I'm just going to give instructions for some of these things. In fact, the truth of the matter is that the very day we visited the hospital, which of course I was accused of greeting somebody, that very day I gave that instruction that they should look at the internal security, and I had the opportunity to also speak to the police. So some of these things have already started and they are in motion.
In a bid to improve Ghana's health system, the committee expects government to provide avenues for continuous engagement and sensitization of the public on how facilities operate, especially in relation to emergency response to care. George Queening, TV3 News, Ministry of Health, Accra.